Hello everybody, I'm Dr. Armen, Professor Armen Astvatsatryan from Yerevan, Armenia, and you are on Dr. Y channel. Dr. Y channel is my channel. Hello everybody, I'm Professor Armen Astvatsatryan. Take your pens, papers for making the notes, and we continue your questions about last examinations questions, big exams questions. And today's question is all about ankylosing spondylitis. Ankylosing spondylitis. Okay, let's go with ankylosis spondylitis. Okay. Ankylosis spondylitis.
Ankylosing spondylitis.
Ankylosing spondylitis. Okay, my friends, if you find question about ankylosis spondylitis, you can find just after that Bekhterev disease. Bekhterev disease, Russian physician, great physician, and this is a tradition to pronounce his name with this disease, actually the synonym of this disease, Bekhterev disease. Unfortunately, in Anglo-Saxon countries, in Western countries, don't know about this great physician. But anyway, Bekhterev disease and ankylosing spondylitis is the same thing. So, ankylosing spondylitis. So, what is ankylosing spondylitis? Ankylosing spondylitis is prototypical spondyloarthropathy, and a systemic disorder characterized by inflammation of the axial skeleton, large peripheral joints and digits, nocturnal back pain, back stiffness, accentuated kyphosis, constitutional symptoms, aortitis, cardiac conduction abnormalities, and anterior uveitis. Diagnosing requires showing sacroiliitis or imaging. Treatment is with non-steroidal anti-inflammatory drugs and sometimes, why not, tumor necrosis factor antagonists or interleukin-17 antagonists, and physical measures that maintain joint flexibility. So that's largely enough. What is ankylosing spondylitis? We have answered. But who knows? Maybe there will continue your question. So I find a lot of points. Let's answer on the all points. So issues. Etiology. Ankylosing spondylitis is a chronic inflammatory rheumatic disease that primarily affects the spine and the sacroiliac joints, leading to pain, stiffness, and eventual fusion of the vertebrae back. The exact etiology of actually ankylosing spondylitis is not fully understood. We don't know actually. But it's believed to involve a complex interplay of genetic, immunologic, and of course environmental factors. Anyway, it's an autoimmune disorder. So genetic factors are thought to play significant role in the development of acute ankylosis spondylitis. The presence of a specific genetic marker called human leukocyte antigen HLA-B27 is strongly associated with ankylosis spondylitis. However, not all individuals with this HLA leukocyte antigen human leukocyte antigen B27 develop this ankylosing spondylitis, indicating that other genetic factors are likely involved as well. Immunological factors. The immune system is believed to play a key role in the development of ankylosing spondylitis. Actually, that's why rheumatologists engaged in this problem. So it's thought that an abnormal immune response triggered by genetic factors leads to chronic inflammation, particularly in the spine and the sacroiliac joints. This inflammation results in the characteristic symptoms of this symptom of ankylosing spondylitis. Environmental factors. Although not fully understood, environmental factors may also contribute to the development of ankylosing spondylitis. Some studies have suggested that exposure to certain infections, such as bacterial infections and in the gastrointestinal tract, may trigger or exacerbate the immune response, leading to ankylosing spondylitis in susceptible individuals. Other environmental factors, such as smoking, of course, have also been associated with an increased risk of developing of acute ankylosing spondylitis. Sex and age. Ankylosing spondylitis tends to affect males more frequently than females and typically presents in early adulthood between the ages of 15 and 30 years. Hormonal, anatomical, and other factors related to sex and age may also play a role in the development of ankylosing spondylitis, although the exact mechanisms are not well understood. Overall, the etiology of acute ankylosing spondylitis is likely multifactorial, involving a combination of genetic, immunological, environmental, and other factors. Further research is needed to better understand the complex interplay of these factors or how they contribute to the development and the progression of ankylosing spondylitis. Next is the pathogenesis. Ankylosing spondylitis pathogenesis involves a complex interplay of genetic, immunological, and inflammatory processes that ultimately result in chronic inflammation of the spine and sacroiliac joints. So the exact sequence of events leading to the development of ankylosing spondylitis is not fully understood, as I mentioned above, but several key mechanisms have been proposed. My friends, take pens and papers to make the notes. So, genetic susceptibility. Ankylosing spondylitis has a strong genetic component, with more than 90% of patients with ankylosing spondylitis carrying the human leukocyte antigen HLA-B27 gene. However, not all individuals, as I said, with HLA-B27 develop ankylosing spondylitis, indicating the other genetic factors are likely involved as well. Other genes associated with ankylosing spondylitis, such as ERAP1, interleukin-23R, and interleukin-1A, have also been implicated in the pathogenesis of the disease. But okay, you can't, it's not obligatory to answer in this manner about another antigens. You answer just HLA-B27 is largely enough. Autoimmune response. So abnormal immune response is believed that in generally susceptible individuals, an abnormal immune response is triggered, leading to chronic inflammation. The exact trigger is not well understood, but it's thought that microbial antigens from the gut or other sites may stimulate an exaggerated immune response in susceptible individuals. This results in the recruitment of immune cells such as T cells and macrophages to the spine and sacroiliac joints, leading to inflammation. So-called inflammatory cascade. So what's inflammatory cascade? The inflammatory cascade in ankylosing spondylitis involves the production of various pro-inflammatory cytokines such as tumor necrosis factor TNF-alpha, interleukin-6, interleukin-17, which contribute to the inflammation and tissue damage. These cytokines promote inflammation, induce bone resorption, and activate osteoclasts, leading to erosion of the bone and eventual fusion of the vertebrae. New bone formation. Ankylosing spondylitis characterized by abnormal new bone formation, particularly in the spine. This is thought to be a result of the inflammatory process triggering the release of signaling so-called signaling molecules that promote osteoblast activity, leading to the formation of new bone. Over time, this new bone formation can lead to characteristic changes seen in ankylosing spondylitis, such as syndesmophytes or syndesmophytes, bony bridges, syndesmophytes, bony bridge, and ankylosis, fusion of the vertebrae. Enzymes, role of the enzymes, don't forget about that. Enzymes such as matrix metalloproteinase, MMPs, metalloproteinase, matrix metalloproteinase, and osteoprotogerin, OPG, have also been implicated in the pathogenesis of ankylosing spondylitis. So matrix metalloprotease are involved in tissue remodeling and can contribute to bone erosion, while OPG is a protein that regulates bone resorption. Imbalance in the production and activity of these enzymes may contribute to the inflammatory and bone remodeling, my friends, processing in ankylosing spondylitis. Other factors such as mechanical stress on the spine may also play a role in the pathogenesis of ankylosing spondylitis. Mechanical stress due to repetitive microtrauma or abnormal loading on the spine may trigger an inflammatory response, leading to chronic inflammation and subsequent tissue damage. Maybe it's a speculation, but anyway. So, in summary, the pathogenesis of acute ankylosing spondylitis is a complex and involves a combination of genetic, immunological, inflammatory, and bone remodeling processes. Further research is, of course, needed to fully understand the underlying mechanisms and develop targeted therapies for this chronic inflammatory autoimmune rheumatic disease. Classifications. So actually classifications, this means, well, we'll talk about criteria. Yes, so ankylosing spondylitis is a form of chronic inflammatory arthritis that primarily affects the spine and sacroiliac joints. It's classified as a type of spondyloarthritis, which is a group of related inflammatory diseases that share common clinical and gen features. Ankylosing spondylitis is typically classified based on various criteria, including clinical manifestations, radiographic findings, laboratory results. Okay, some commonly used classification criteria for ankylosing spondylitis, maybe they will ask you. So if you asked, you answer like this: modified New York criteria. Actually, I'm sure nobody will ask you, but who knows? So modified New York criteria. This is the most widely used classification criteria for ankylosing spondylitis, which is based on imaging techniques, on radiographic findings. According to the modified New York criteria, a definitive diagnosis of acute ankylosing spondylitis requires the presence of radiographic evidence of sacroiliitis, inflammation of the sacroiliac joints on X-rays, along with at least one of the following clinical features: low back pain and stiffness for more than 3 months, limitation of lumbar spine motion, and third, limitation of chest expansion. Sometimes now they add 4, presence of HLA-B27 antigen. Okay, so once again, New York criteria: low back pain, stiffness for more than 3 months, limitation of lumbar spine motion, limitation of chest expansion, and presence of HLA-B27. Assessment of spondyloarthritis, International Society, so-called ASAS criteria. The ASAS criteria are more sensitive and include not only imaging techniques, but also clinical features. According to ASAS criteria, a diagnosis of axial spondyloarthritis, AXSPA, which includes both non-radiographic axial spondyloarthritis, NRIXPA, and radiographic axial spondyloarthritis, can be made based on the presence of sacroiliitis on MRI. So RxSPA, equivalent to ankylosing spondylitis. I'm sorry. So assessment of spondyloarthritis, International Society, ASAS. Once again, the ASAS criteria are more sensitive and include not only graphic findings, but also clinical features. Okay? AMOR criteria. The AMOR criteria are clinical classification for spondyloarthritis, including ankylosing spondylitis, which are based on a combination of clinical features. According to the AMOR criteria, a diagnosis of spondyloarthritis can be made in patient has inflammatory back pain, defined by certain specific criteria, along with the presence of at least one of the following: arthritis, enthesitis. Enthesitis is inflammation at the site where tendons or ligamenta attach to a bone. Enthesitis. Uveitis or uveitis, or positive family history of spondyloarthritis. European spondyloarthropathy study group, ECG, ES, European Society, spondyloarthritis group criteria, ESSG criteria. The ESSG criteria are another set of clinical classification criteria for spondyloarthritis, including ankylosing spondylitis. According to these criteria, a diagnosis of spondyloarthritis can be made if a patient has inflammatory back pain defined by certain specific criteria, along with the presence at least two of the following: arthritis, enthesitis, uveitis, dactylitis. Dactylitis is inflammation of entire finger or toe. Psoriasis, inflammatory bowel disease, and positive family history of spondyloarthritis. It's important to note that the classification criteria are meant to aid in diagnosis and not absolute rules. Golden rule. Huh? A diagnosis of acute ankylosing spondylitis should be made by a qualified autoimmune specialist. Thorough evaluation of patient's clinical history, physical examination, laboratory test, imaging findings, etc. So, my friends, I know there is a lot of information. That's why I said take pens and papers to make the notes. And several times re-listening this video with your earrings. What is the problem? Instead of spend the time in YouTube or TikTok. So, ankylosing spondylitis clinic. So, if you find a question like this, once again, my friends, if you find term clinic means signs and symptoms. No clinical signs and symptoms, of course. What else? So, ankylosing spondylitis is typically present with a variety of signs and symptoms that primarily affect the axial skeleton, including the spine and the sacroiliac joints. The signs and symptoms of ankylosing spondylitis can vary in severity and may develop gradually over time. Common signs and symptoms: back pain. Persistent and chronic low back pain is one of the hallmark symptoms of ankylosing spondylitis. This is a hallmark symptom. The pain is typically dull but and may worsen at night or in the morning, and it tends to improve with physical activity and exercise. Stiffness. Stiffness, especially in the morning or after a period of inactivity, is a commonly symptom of ankylosing spondylitis. The stiffness can be severe and may last for several hours. Ankylosing spondylitis can cause decreased flexibility and mobility of the spine, leading to a stooped posture and limited range of motion in the neck, back, and hips. This may result in difficulty in bending, twisting, or turning. Enthesitis. Enthesitis refers to inflammation at the sites where tendons or ligamental attach to bone. In ankylosing spondylitis, enthesitis commonly occurs at sites such as heels, Achilles tendon, and the bottom of the feet, plantar fascia, leading to pain, swelling, and tenderness. Sacroiliitis or sacroiliitis, inflammation of the sacroiliac joints which connect to the spine to the pelvis, is a hallmark feature of ankylosing spondylitis. Sacroiliitis, sacroiliitis can cause pain and stiffness in the lower back, buttocks, and hips. Fatigue. Many people with ankylosing spondylitis experience fatigue and a general feeling of being unwell, which can impact their daily activities and quality of life. So, uveitis, eye inflammation. Ankylosing spondylitis can also cause inflammation of the eye. Uveitis or uveitis or iritis, which may result in redness, pain, sensitivity to light, and blurred vision. Other symptoms: in some cases, ankylosing spondylitis may be associated with other symptoms such as chest pain or discomfort, difficulty taking deep breath, weight loss, and mild fever. It's important to note that the signs and symptoms of ankylosing spondylitis can vary widely among individuals, and not all people with ankylosing spondylitis will experience all of above-mentioned symptoms. It's also worth mentioning that ankylosing spondylitis is a chronic condition that tends to worsen over time. But early diagnosis, of course, and appropriate management can help to manage symptoms and improve quality of life. Diagnostic criteria, differential diagnosis. Ankylosing spondylitis typically involves a combination of clinical assessment, medical history, physical examination, and imaging techniques. There are also established diagnostic criteria that are commonly used to aid in the diagnosis of ankylosing spondylitis. Differential diagnosis, which involves ruling out other conditions they may present with similar symptoms. It's also an important step to diagnostic process. Diagnosing of ankylosing spondylitis is typically based on a combination of the clinical assessment. So doctor will take detailed medical history, including asking about onset and duration of symptoms, family history of ankylosing spondylitis or other inflammatory conditions, and conducting physical examination to assess for signs of inflammation, limited range of motion, and other characteristic findings associated with ankylosing spondylitis. Diagnostic criteria, imaging techniques, X-ray or magnetic resonance imaging, MRI, of the sacroiliac joints and spine may be used to detect signs of inflammation, erosion, and other changes characteristic of ankylosing spondylitis. X-ray may show typical findings such as bilateral sacroiliitis, bilateral sacroiliitis, inflammation of both sacroiliac joints, syndesmophytes, bony outgrowths, and bamboo spine, fusion of vertebra. Diagnostic criteria of ankylosing spondylitis. There are established diagnosed criteria that are widely used in the diagnosis of ankylosing spondylitis. So once again, why not New York criteria? The modified New York criteria. These criteria are commonly used and required imaging techniques of sacroiliitis, grade 2 or higher, bilateral or grade 3 or higher unilateral, plus the presence or at least one clinical feature, that's why it's modified criteria, such as inflammatory back pain, limited lumbar spine motion, or limited chest expansion. Differential diagnosis. Ankylosing spondylitis shares similarities with other conditions, and a thorough evaluation is necessary to rule out other possible causes of similar symptoms. So differential diagnosis of ankylosing spondylitis may include mechanical low back pain, non-inflammatory low back pain due to mechanical causes such as muscle strain, disc degeneration, or osteoarthritis can sometimes be mistaken for ankylosing spondylitis, but anyway, there is no low back pain, no inflammatory pain. It's absurd. But it's described like this. So any pain is inflammation. no inflammatory back pain. But anyway, you can answer in this manner. So, no inflammatory back pain due to mechanical causes such as muscle strain. And muscle strain is without inflammation. What are we talking about? Other forms of spondyloarthritis, conditions such as reactive arthritis, psoriatic arthritis, and enteropathic arthritis may also have similar clinical features to ankylosing spondylitis and need differentiated through the careful assessment. But anyway, psoriatic arthritis also, and as other conditions, also autoimmune disorders. Other causes of sacroiliitis, such as bacterial or viral infections, such as bacterial or viral sacroiliitis or sacroiliitis, and other inflammatory conditions such as lupus erythematosus may also present with sacroiliitis and need to be considered in the differential diagnosis. It's important to consult a qualified healthcare professional for proper evaluation and diagnosis if you suspect your patient may have ankylosing spondylitis or experiencing symptoms suggestive of ankylosing spondylitis. Next is ankylosing spondylitis treatment. So treatment typically involves a multidisciplinary approach aimed at managing symptoms, preventing the complications, and improving quality of life. The treatment plan for ankylosing spondylitis may vary depending on the severity of the disease, the presence of complications, and individual patient factors. Let's talk about that. Medications. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs are commonly prescribed to relieve pain, reduce inflammation, improve stiffness associated with ankylosing spondyloarthritis. Examples of this NSAID used in ankylosing spondyloarthritis: indomethacin, naproxen, celecoxib. Disease-modifying anti-rheumatic drugs, the MARDs. DMARDs, disease-modifying anti-rheumatic drugs. The MARDs, such as sulfasalazine, may be prescribed to help control inflammation and slow down the progression of ankylosing spondylitis in some cases. Now it's very fashioned to give biologic agents such as tumor necrosis factors, TNF, including TNF inhibitors. Adalimumab and etanercept are a type of medication that specifically targets the immune system to reduce inflammation in ankylosing spondylitis. These medications are typically reserved for more severe cases of ankylosing spondylitis or when other treatments are not effective. Of course, corticosteroids, oral or injected corticosteroids, may be used for short-term symptom relief, very good symptom relief actually, in some cases of ankylosing spondylitis, but they are generally not recommended for long-term, of course, due to potential bad side effects. Physical therapy and exercise. Physical therapy may be recommended to improve flexibility, strength, and posture, and to help manage pain and stiffness associated with ankylosing spondylitis. Exercise. Regular exercise, particular exercises that promote spinal mobility, posture, and flexibility, such as swimming, yoga, and stretching, can help improve symptoms and maintain functional ability in ankylosing spondylitis. Lifestyle modification, posture management, maintaining good posture, and avoiding positions that worsen symptoms, such as prolonged sitting or standing can help manage pain and stiffness associated with ankylosing spondylitis. Smoking cessation. Smoking has been shown to worsen ankylosing spondylitis symptoms, and quitting smoking can be beneficial in managing of the disease. Healthy lifestyle, eating a well-balanced diet, maintaining a healthy weight, and manage stress can also contribute to overall well-being in ankylosing spondylitis, of course. Now, of course, other interventions, heat and cold therapy, ankylosis. Applying heat or cold to affected joints can help relieve pain and stiffness and ankylosing spondylitis. Heat such as hot showers or warm compresses can help relax muscles and improve joint flexibility, while cold such as ice packs can help reduce inflammation and swelling. Assistive devices. In some cases, the use of assistive devices such as orthotics, braces, or cans may be recommended to help manage pain, improve posture, and maintain mobility. And finally, surgery. Surgery in severe cases of ankylosing spondylitis with significant joint damage or deformities, surgery may be considered to correct spinal deformities, replace damaged joints, or address other complications. It's important to work closely with a qualified healthcare professional, of course. And finally, ankylosing spondylitis rehabilitation, rehab. So rehabilitation plays an important role in the management of ankylosing spondylitis, as it aims to improve function, relieve pain, and enhance the overall quality of life for individuals with ankylosing spondylitis. A comprehensive rehab programs for ankylosing spondylitis may include physical therapy. Physical therapy can help improve flexibility, strength, posture, and overall physical function in ankylosing spondylitis. Physical therapists may use a variety of techniques such as stretching, strengthening exercise, and the manual therapy as therapy to address specific limitations and pain associated with ankylosing spondylitis. They may also provide guidance on appropriate exercise, body mechanics, and postural training to help individuals with ankylosing spondylitis manage their condition effectively. So-called occupational therapy that focuses on improving the ability to perform daily activities such as dressing, grooming, and household tasks which may be affected by ankylosing spondylitis. Occupational therapists can provide recommendations and interventions to help individuals with ankylosing spondylitis adapt to their limitations and develop strategies for performing activities with less pain and discomfort. Pain management in techniques. Rehabilitation may involve pain management techniques such as heat and cold therapy, transcutaneous electrical nerve stimulation, and other modalities to help relieve pain and discomfort associated with ankylosing spondylitis. Education and self-management. Yes, rehabilitation may include education of acute ankylosing spondylitis, including information on the condition, its management, and strategies for coping with pain and fatigue. Self-management techniques such as stress management, relaxation techniques, and energy conservation strategies may also be taught to help individuals with ankylosing spondylitis manage their condition and improve their overall well-being. Assistive device. Rehabilitation may involve the use of assistive devices such as orthotics, braces, or cans to help individuals with ankylosing spondylitis manage pain, improve posture, and maintain mobility. Psychosocial support. Ankylosing spondylitis can have a significant impact on individual mental health and well-being. Rehabilitation may involve psychosocial support such as counseling to address emotional challenges associated with ankylosing spondylitis such as depression, anxiety, and coping with chronic pain and disability. Psychosocial support. Ankylosing spondylitis can have a significant impact on the individual's mental health and well-being. It happened. Rehabilitation may involve psychosocial support such as counseling to address emotional challenges associated with ankylosing spondylitis such as depression, anxiety, and coping with chronic pain and disability. Lifestyle modifications. Rehabilitations may involve guidance on lifestyle modifications such as posture management, ergonomic adaptations at home or work, smoking cessation to help individuals with ankylosing spondylitis manage their condition effectively. Thus, the specific components of a rehabilitation program for ankylosing spondylitis will depend on the individual needs and conditions of each patient and may be tailored accordingly. It's important to work with a qualified rehabilitation team, including physical and occupational therapists, to develop a personalized rehabilitation plan that addresses the unique needs of individuals with ankylosing spondylitis and helps them achieve their functional goals. 35 minutes I am talking. Of course, there is no time. It's absolutely impossible to answer in this manner. So that's why I said you, if you answer the beginning of this lecture, is for me it's highly, it's great. It will be highly appreciated. It's largely enough. So thanks for your attention, my dear friends. I will wait you for another lectures. In next lectures, for another lectures. See you in another lectures. Don't forget to follow and subscribe the channel. God bless you. See you in the next in the other lectures as also. Bye bye.